this is the tutorial on the lithium augmentation. So the instruction to the candidate is you've been asked to speak to Mrs. Watson, who's been treated for depression and she's not responded to the antidepressants, and the next line of treatment is lithium. So the instruction to the candidate is speak to Mrs. Watson and address her views, concerns and expectations, and discuss with her the further management with lithium. So the checklist here and the bullet points which I want you to bear in mind and also to jot down are the following 4 factors. The first thing is to establish the treatment-resistant depression. 2, to highlight the rationale for using lithium in treatment-resistant depression for augmentation. 3, more psychoeducation on lithium in terms of explaining the effects, side effects, monitoring and precautions, and any other measures that might be taken when someone is taking lithium. And 4th, you might suggest alternative forms of treatment. So, candidate, the key skill for any information given station, and not only related to this lithium station, is that you need to make it a two-way conversation, and that's point number 1. Point number 2 is that you need to give bite-sized chunks of information, and I will discuss each one in detail. By making it a two-way conversation, you're ensuring that you're not overloading the patient with information, and you are also addressing their views, concerns and expectations. From experience of having done information giving stations and observed others, I think it is important in making it a two-way conversation, because a lot of the times we have a lot of information that we need to give, however not understanding that the person has specific questions which they would like addressed. Secondly, was to give bite-sized chunks of information. So here again, this is to prevent information overload. So it's about giving bite-sized chunks of information and checking periodically the understanding of the person. These 2 communication skills will ensure that you are giving information at the right pace and that you're not overloading the person with information. And it will also show that you are actually listening and understanding their situation, and you're addressing their views, concerns and expectations, which is actually expected in these information giving stations. So I urge you to follow those 2 techniques, because it's easy to get carried away with giving a lot of information without actually understanding how much information needs to be given. And as I've mentioned, this is an approach which you can use for any information giving stations. So a suggested approach would be the following. Hello, I'm Dr. Mudlia. I'm one of the psychiatrists. I understand that you've been treated for depression with several medications and they've not helped, and that we're thinking lithium would be the next line of treatment. I've come to talk to you more about that. Before we begin, could you tell me about the medication you've been on? So with an introduction like that, you would have built rapport, and asking an open question about the other medications, you would establish the first bullet point, which is to establish the treatment-resistant depression, which is treatment of depression with other antidepressants without benefit. Which would bring you to the next step, which is using lithium as an augmentation agent and the rationale for that. So you would need to explain that lithium is known as a mood stabilizer and is usually used in the treatment of bipolar affective disorder and mania. However, lithium is also known as an augmenting agent or a booster to enhance the effects of antidepressants in people who have been treated with antidepressants and have not responded. This would then move us to the third bullet point of where you'd be able to give more information about lithium. And as I've mentioned earlier, the patient might have questions around what specifically they would like to be answered about lithium. So below are possible questions which the person might have and the possible responses you might give. So she might want to know more about the side effects of medication lithium. So the response would be, as you're aware, like all medications, lithium does have some side effects. They are usually short and self-limiting. We have some short-term side effects and some long-term side effects. The short-term side effects is that it can cause some tummy upsets and can make a person feel sick. It can also have a metallic taste and can cause you to pass more urine. The longer term side effects are that it can cause some skin conditions, weight gain, and can affect the kidney and the thyroid. Would you like to know more about each of any of these? So she might want to know more about the skin conditions. So you can explain that the skin conditions which we find someone taking lithium is psoriasis, eczema, and acne. The next thing would be to talk more about the monitoring and the tests that need to be done prior to taking lithium. So you go on to explain that before starting lithium, because it has these effects on the kidney and the thyroid, we do need to do some blood investigations. So we do blood investigations like a full blood count, a thyroid function test to check the thyroid and the kidney functions. These blood tests are usually done in the initial stages, then weekly, and once the blood level is stabilized, it will be done every 3 months. This will then bring us to the precautions and monitoring. So you would need to explain that the reason why we monitor the lithium levels is that because sometimes the level of the lithium can go high in the blood. The usual range is 0.4 to 1 millimole per liter. If the lithium level goes high in the blood, it can cause some toxicity and it can be life-threatening. That can cause some nausea, some sickness, confusion, convulsions, diarrhea, and can lead to some convulsions and a coma eventually if not treated. So it is important for us to get the level of lithium in the body right, because it is excreted by the kidneys and can cause some problems in the kidneys. So once you've explained that, you need to ensure that you address her concerns around this. As for most patients, the reasons for not wanting to go on lithium would be because of monitoring the blood levels in lithium. Once you've answered the questions around that, the other questions that might occur are about pregnancy, depending on the age of the patient, and if it is a female patient, like in this case. So what you could respond is that we do know that lithium can cause some teratogenicity, or what that means is it can cause some harmful effects to an unborn baby. there is something called Epstein abnormality, which affects the heart, and it occurs in 1 in 100 patients. So usually before someone tries to conceive, and if they are on lithium, they do need to let us know so we can think about how we're going to manage it. Also, we know that lithium passes through the breast milk, and therefore if someone is breastfeeding, it is advisable that they are not on lithium, as this can pass through to the baby, which could cause harmful effects. Other questions which you might have is to find out whether lithium is addictive. The response would be that lithium, as we know, is not addictive. She could also want to find out whether lithium can be taken with alcohol. Well, what we do know is that we usually advise our patients not to take alcohol with any other medications, as this can cause some drowsiness. So it's best to avoid taking alcohol when you are on lithium. The other effects is that there are other ways in which we do advise, like simple measures when people are on lithium, and that is to do with the diet. We do advise our patients to not to follow a low sodium diet, to avoid hot places like saunas, and if you are in hot weather, to avoid being dehydrated and to ensure you are taking enough fluids, and to ensure that you are having plenty of rest and exercise adequately. So in a nutshell, this would be all the information that you would impart about lithium. And as you can see, there is a lot of information that you can give. So it's about making it a two-way conversation, like I've mentioned, and also giving bite-sized chunks of information to ensure that you are mastering the techniques of giving information in an information-giving station. To conclude the station, you can suggest that there are other forms of treatment apart from medication, like psychological treatment, which you can discuss at a later stage. And then a summary of the station could be: thank you, Mrs. Blake Watson, for talking to me. From what we've discussed, I've told you more about lithium and why we think that this would be a good treatment for you. I've also told you more about the side effects and the precautions which we need to take with having blood tests done. I know it's been a lot of information that I've given you. I do have some leaflets which I can give you, and I can arrange to come and see you at another time to discuss when you would like to start the treatment. Is that all right with you? So you can thank the patient and conclude the station. So to conclude the station, we will just recap those 4 points. For the treatment-resistant depression lithium augmentation station, the following 4 points, candidate, that you need to follow are: 1. You need to establish the treatment-resistant depression or refractory depression. 2. You need to highlight the rationale for using lithium as an augmentation agent or booster for antidepressant medication. 3. You need to give psychoeducation on lithium. And 4. You can suggest alternative forms of treatment. I hope you have found this information giving station useful, and like I've mentioned in the beginning of the station, try to use this structure for all information giving stations, and you will see that you'll be able to master the techniques of giving information without overloading the person.